Hello, good morning. Ladies and gentlemen, good morning.
Good morning.
Good morning.
Good morning.
How are you?
Good morning.
Oh, thank God. Okay. The only gentleman among you. Okay. So today we are going to talk about which group is presenting? Embryology. The group.
One.
Group one. Okay. Okay. Have they set up? Have they?
Yeah.
Are they setting up to do the presentation? They should speed up. I'm not comfortable with the way people delay so much. Sometimes,
Sister, we are coming.
15 whole minutes they are using. Okay. Then we are waiting for you. We are waiting for you. We are now 349. So please speed up so that we can finish with this thing.
HAJIA, please, I'm trying to share, but the format is not like my phone is not taking the format. So please, can another person share?
Yes, somebody else can share. If you can't share, you can still go ahead. But you have the notes with you.
Yes, please.
And so you start whilst he tries to, the other person tries to share.
Sure.
So once it is there, then you can follow.
Okay. Okay, HAJIA.
Okay.
Good morning. Please, I'm Edna Ajay, presenting on behalf of Group 3. Our topic is embryology. Embryology is a scientific study of the development and growth of the embryo. Fertilization. It is the fusion or union of the ovum and the spermatozoon to form a zygote. So we are on the process of fertilization. HAJIA, please, can I be heard? Hello, HAJIA.
Please, I can hear you. Please go.
Okay.
I can hear you, so go ahead.
Okay. So we are on the process of fertilization. Following ovulation of the ovum, which is about 0.15 millimeters in diameter, it passes into the uterine tube and it moves along towards the uterus. The movement towards the uterus is waffled by the cilia and peristaltic movement towards the uterus. Okay, cilia and peristaltic of the oviduct. At the time of ovulation, the cervix under the influence of estrogens that attract the spermatozoa. When the man is fertile, during sexual intercourse, he releases about 200 million sperms deposited into the vagina posterior funnels. About 2 million of the released sperms are able to move through the loose cervical mucus. They survive and propel themselves towards the oviduct. Also, those who cannot make it are destroyed by the acidic medium of the vagina. About 200 sperms are able to make to the oocyte. The sperm move from the vagina through the cervical canal by their flagella using its crypt tail. In addition, during sexual intercourse, prostaglandins are present from semen, and uterine contractions aid in sperm's movement to the oviduct. As the sperm reach the oviduct within minutes after intercourse, there is sperm capacitation as sperm are unable or poorly able to fertilize an egg. Capacitation occurs while sperm reside in the female reproductive tract for a period of time. It is stimulated by secretion in the vagina, uterus, and oviduct.
Hello. Your name once again. Hello.
Please, I'm Edna.
Okay.
Edna Eje.
Edna, let me make a summary, a quick summary of what we are reading. Please, hello. Let's follow it. She's trying to tell us the embryology, and the issue is that once the ovum is released, please, I'm starting from where you started. Once the ovum is released, in fact,
yes, please.
The fimbriae ovarica, one of the fimbriated end of the fallopian tube is longer than the rest. That is the fimbriae ovarica. It will just make an attempt stretch to pick the ovum so that it doesn't drop into the. Please, can you hear me?
Yes,
please, can you hear me?
Yes.
Yeah. It will just stretch. And the stretching of the fallopian tube, the fimbriated end of the tube, in an attempt to receive the ovum so that it doesn't drop into the peritoneum, brings about what we call metasmesh. That is painful ovulation. Where the egg has been released, there will be sometimes tiny blood vessels will get ruptured, and it will be, bleeding will occur at that spot there. That can also cause the pain for the individual. And then the fallopian tube, in an attempt to stretch to pick the ovum, can also cause pain to give painful ovulation. I'm stressing on this thing because sometimes a couple may approach you as a midwife, telling you that, please, I want to achieve pregnancy. We have married for 1 year, 2 years, pregnancy is not being achieved. But then she's going through this. When there's metasmesh pain, she's so comfortable to allow the husband, to have sex with her. And in that case, she can't become pregnant. So we as midwives have to understand this physiology, this embryology, so that we will encourage the infertile couple, if I may put it that way, so that we will encourage her that irrespective of the pain that she may be experiencing, she should try to pregnancy. Now, they also through the fallopian tube by a process of wafting. That is the word she was struggling to mention. By wafting, and the wafting is taking place by the ciliated epithelium that lines the fallopian tube. So it will prepare the ovum that is released to the ampulla. Then it will go there and then it will go and wait in the ampulla, waiting for the sperm to come and fertilize it. Now, she mentioned also that as the ovum is waiting in the ampulla, then that day, if you happen to have sex, then the sperm that are ejected at the funnels of the fallopian tube, in fact, the fundus of the vagina, will manipulate their way through the cervix. And that's why she was saying that in the vagina, some of the alkaline, the acidic medium of the vagina will, in fact, destroy some of the sperm to the surface by the help of the arbor vitae. By the help of the arbor vitae, that is the mucous lining, the endometrium of the cervix. It is arranged in a tree-like manner. And so, like, that is what we call the arbor vitae. It was a entry the fallopian tube where the race is taking place. Then they will go and meet the ovum that is waiting at the ampullary portion of the fallopian tube. It's very interesting. So, madam, take your time and read it well and explain. But I've done the explanation. On reaching the ovum, that is where one of them will be smart enough. One of them, like you and I, we were so smart enough. We then quickly produce the enzyme hyaluronidase. The enzyme is called hyaluronidase. It will just produce it fast to dissolve the outer covering of the ovum that is waiting at the ampulla, and then it will enter. The rest of them, as soon as one of them penetrates, the rest will have to come out. So if you're a midwife and a client tells you, Auntie, I want to become pregnant, but then when I have sex with my husband, as soon as I get up, the fluid comes out. That is their complete standard. After all, it will have to come out. It's only one, even if fertilization will take place, it is only one. And the rest will have to come out. And imagine if the rest doesn't come out, aren't you going to get a toxicity of sperm? If every day they don't come out, it's accumulating in your tube, you yourself, you fall sick. So the coming out as they complain is normal. It's normal that if fertilization will even take place, it is only one. The rest 200 million of them will have to come back. So when they're complaining to you, you have to explain to them. I hope I'm done with this explanation. Somebody says, yeah, the one whose hand is up, please, can you come out with your points? Hello? Hello, please, I've seen somebody's hand up. You have raised the hand. Can you go
please,
ahead?
we are the ones facilitating.
Oh, okay, that's fine. That's fine. So why is it that your hand is up? I thought you wanted to ask for clarity or any question. Okay, then let's move on. So continue from.
Okay. Capacitation, please reread. Capacitation occur while sperm reside in the female reproductive tract for a period of time.
Edna, please let me confirm.
Okay.
Please, capacitation occurs while the sperm resides in the female reproductive tract for a period of time. It is stimulated by secretion in the vagina, uterus, and oviduct. Capacitation takes place about 5 to 7 hours. So what we are trying to say is that whenever the sperm gets into the vagina, it is through a word capacitation. This process will help to stimulate the secretions in the vagina. That will propel, that will help with the uterus and the oviduct. That will help the sperm to be able to move through the female reproductive tract towards the oviduct to be able to fertilize the ovum that is released. And this capacitation period takes 5 to 7 hours. It is also associated with the removal of adherent Siemens plasma protein. And then there is a recognition of plasma membrane, lipid, and proteins. Increase in cyclic APM and decrease in intracellular pH. So whenever there is this capacitation going on, there will be a decrease in the pH in the woman's vagina. Then the sperm will also display hyperactivity. They will become so active because they are fighting. They are all fighting to get in so that they will fertilize the ovum. So as HAJIA said, the fastest one, like you and I, will be in a hurry to go and fertilize the ovum. Then they also undergo a acrosome reaction. So the acrosome reaction is where they remove the covering of the sperm, then they will penetrate it by using the reaction. The reaction is when they will try to use sorry, I don't even know how to say it. Hydrolyzate. Then they will remove their head and penetrate and fix with the ovum to become one and start fertilization. So we have the pictures down there. We have the pictures down there showing how fertilization starts in the woman. Then it also talks about the zona pellucida, secret chemicals that attract the capacitated sperm. So during fertilization, the zona pellucida of during fertilization, the zona pellucida will also release a chemical. That is, the zona pellucida is found on the sperm, and this one will make sure that it will attract or secrete a chemical, and this chemical is going to penetrate, will help in the penetration of the sperm into the ovum. Then the acrosome layer of the capacitated sperm become reactive and release the enzyme hydrolyzase called the acrosome reaction. That was what I was talking about. That will bring the breakage of the ovum wall, then the sperm will enter. Then the first spermatozoa that gets to the zona pellucida will bind with the penetration of the membranes of the ovum. I've already said that. Please, can we move on? So after they have bind together, the sperm nucleus and the ovum nucleus has bind together, then fertilization starts. When the ovum has been fertilized, it continues its journey through the oviduct and reaches the uterus in 3 days. So the fertilization happens in the ampulla. So as HAJIA said, the ciliary epithelium or the ciliated epithelium will prepare it with the help of other hormones, will prepare it gradually. Then it will take about 3 days for this fertilized ovum to reach the uterus. At the state of a zygote, so at that moment, it is called a zygote, and it's surrounded by membranes of the glycoprotein, that is the zona pellucida. Then on the journey of the zygote, it is being nourished by the globular cells of the oviduct. Later secretion gland of the uterus. So it takes its nourishment from the oviduct and the uterus as it goes on. Then we are going to the development of the zygote. So when there is fertilization has already taken place, it continues its journey. As it continues its journey, during the journey, there is a cell division. There's a cell division, and this cell division, as it takes place, that is where we'll see the blastomeres, the cleavage, division called the cleavage. So during this division, the cell, it will take a day into 4 cells. So for the first time, the cell will divide into 2. For the second day, the cell will divide into 4. Then as it continues, cell division takes place as we saw in the picture. Then it will get to the molar. The molar is produced by the continuous reproduction of zygotes. Cell division is divided by the hormone progesterone. So with the help of progesterone, the cell division, as it continues, we'll get the molar. Then from the corpus luteum, so during fertilization, within that period, placenta has not yet developed. So it is from the bust of the corpus luteum, the mature Graafian follicle. When it's being burst, it will produce the ova. Then the shell left behind is the corpus luteum, and this corpus luteum is going to nourish the fertilized ovum till when placenta will develop. So all the nutrients, all the food that will be taken, the nutrients will be taken from the oviduct, and the corpus luteum will take over to produce nutrients for the fertilized ovum till placenta is being developed. Then a fluid-filled capacity called the blastomeres appear in the molar. At this stage, the zygote known as the blastulation or blastocyst, comprising of about 58 cells, and the process is developed from the molar to the blastocyst is called the blastulation. So the process by which the mitotic division is happening, where the molar will be filled with a fluid, and as it goes on and goes on, then the molar continues to undergo cell division, which is called the blastulation or the blastocyst. The process that the molar goes in, then we'll call the process as blastulation. Please, can we go on? In the inner cell of the embryo plates, I can't see it well, which develops in a form of fetus, is the umbilical cord or the amnion. So during the process, the outermost of the blastocyst is a single layer of a cell called the trophoblast. So during the process, there is a division. So the outer part of the molar becomes the trophoblast. Then the inner mast cell or the inner one that are formed with the embryonic plates, that is the inner cell, will be forming the placenta, the chorion, and the inner mast cell. Then that is where we'll find the fetus, the amnion, and the umbilical cord. Then during that process too, it's like lies freely for about 3 or more days. Then the trophoblast will continue and development will continue. Then we are going to the embedment of the zygote. How do the zygote embed in the uterus? Please, the one sharing the screen, you are moving it so I can't even read. Embedment of the zygote. So when the blastocyst enters into the uterus, like it remains in a cavity. So it's within a cavity, that is 2 to 3 days. And during this time, that is where the embedment will happen. Please bring it down a little. I can't read that part. Yes.
You can't see your screen. No. It's very blurry for us here. You are not seeing
So
anything.
myself reading, I can't see it well. But please, the one sharing should bring it a little downwards for us to see.
Can I continue?
Yes, you can continue.
Mr. Vero, please continue. You are muted.
Please, Sister Very, you said you want to continue. Please continue for us.
So embedding of the zygote, as my sister was saying, when the blastocyst enters the uterus, it remains in the cavity for about 2 to 3 days, and during which the blastocyte attaches itself to the epithelium and penetrates into the underlying stroma in the anterior or posterior wall of the body of the uterus. And then the implantation window, it occurs within the 6 to 10 weeks, is crucial for attachment. And during
Hello. Hello.
Hi.
Yeah, it's like I was muted from the ICT center. I was muted from the ICT center, so I wasn't getting access to unmute myself until I spoke with him, and then he has now muted. Please stop making noise and then concentrate on this embryology. The one presenting. You know, you mentioned zona pellucida, but you mentioned that the zona pellucida is in the sperm. I was thinking that the zona pellucida is part of the surrounding layers of the ovum. That the enzyme hyaluronidase will be able to digest it so that the head of the sperm can penetrate and enter. That is the correction I wanted to make, but I was finding it difficult to unmute myself. Now I've been able to do it. That's why I'm making that correction. So please go on. If you think you can't you find a way of widening up? Just press on it and then stretch out your hand. It will become a little bit bigger for you to read. It's very, very interesting topic, embryology. I heard the papa. So please do it. Continue doing it the way you are going by it. Go ahead. The one doing the presentation, please go ahead. Hello.
Hello, Ajay. Let me come back again and still present. This, we were on the embedment of the zygotes. That one we are saying that with the blastocyst enters into the uterus and it remains in the cavity for about, we were saying, then during which the blastocyst attaches itself to the epithelium and penetrates into the underlying stroma in the anterior of the posterior wall of the body of the uterus. So whenever the zygote gets into the uterus, it has a particular place where it can itself. So the embedment area is the underlying stroma of the anterior or the posterior wall of the uterus. So when you get to either the anterior wall or the posterior wall of the uterus, that is where the zygote will embed itself. Then implantation windows take place between the 6 to 10 days. Is crucial for attachment. So during this time, the woman needs to be very careful because implantation take place. And in this stage is where we can sometimes find implantational bleeding, because during the implantation, there can be bleeding from the uterine walls. So if this woman sees it, sometimes they say they are menstruating. No. So we need to be able to differentiate between implantational bleeding and normal normal bleeding, so that we can advise them as so. Then estrogen and progesterone actions opens in the window. So this is when estrogen and progesterone become so high in the woman's system. Then the trophoblast, especially the part which lies over the inner cell mass, then becomes straightly adhered to the endometrium. So the trophoblast, that is the outer layer of the molar cell, becomes so attached to the uterine wall. Then embedment or nesting or nidation is normally completed in 11 days after ovulation. So embedment of the zygote, it takes from day 1 during ovulation, so till the 11th day after the woman has the fertilization has taken place, embedment has already taken place in the woman's uterus. Then endometrium closes. So the endometrium closes, nothing goes in, nothing comes out. The evidence of the presence is by the blastocyst. It's a small plug bulge of the surface. That is about the embedding. Then we are going to the
Hello.
Ajia.
Yeah, please. Can somebody tell the ICT man? Those of you who have his number, tell him that I'm part of this thing. He has made it. At first, I wasn't able to talk because, like, he muted me, and then when I called him,
He said that he's not seeing me as part of the
HAJIA.
That is what he said.
HAJIA.
So please, hello.
Sister,
Yes.
please, it's not the
Yes,
ICT man,
Anna.
it's me. It's me.
You muted me. He called me. He said he's not seeing me.
The class
as part
was
of
becoming noisy, so I muted everyone. No, the class was becoming noisy, so I muted everyone. But I was sending you message to unmute. I did it several, but you were not unmuting yourself.
I've unmuted it now. But I'm saying that can you call Mr. Yusuf? Honorable Yusuf, call him and tell him that I'm part of the group. I'm hosting the program, so tell him for me.
Sister,
because
I'm the one controlling the thing.
So you can't call him,
HAJIA.
Yes.
No, I'm the one controlling. He is not the one doing that. I am the one doing that.
No, but he called me and said he's not seeing me on the screen where he's in the control room there.
Oh, okay.
He's not seeing me as part in the control room. And that's what I'm saying, that call him and tell him that I'm around, I'm with you.
Okay, sister.
Do that for me, please. Do that.
Okay, sister. Okay.
Okay. Thank you. So the one doing the present, please, the last sentence that you said, can you go over it? I have something to add. At that point where you said you only see a bulge and that kind of thing. So please, I want you to go over that
please,
portion
Juliana,
for me.
Can you put your video on? Juliana. Please, someone should prompt
the last sentence that you read, can you go over it? The one doing the presentation, can you go over it for me, please? The last sentence you said, the one you read with regard to nidation and then implantation. Can you go over it? Because I have something to add at that point. Embedding of the zygote. Yeah, read over that part, that portion again. Please just read over that portion, okay? Oh my goodness. And I'm sorry, I said, hello.
Hello, HAJIA.
Okay. Yes, hello. Yes. Go ahead, please.
When the blastocyst enters into the uterus, it remains in the cavity for about 2 to 3 days, during which the blastocyst attaches itself to the epithelium and penetrates into the underlying stroma in the anterior or posterior wall of the body of the uterus. The implantation window, that is from the 6 to 10 days, is crucial for attachment. Then estrogen and progesterone action opens the window. The trophoblast, especially the part which lies over the inner cell mass, then becomes strictly adheres to the endometrium. It begins to secrete a substance which digests the endometrium. Embedment, nesting, nidation is normally completed by 11th day after ovulation, and endometrium closes over it completely. The evidence of the presence of the blastocyst is a small bulge on the surface.
Good. Hold, please. This is the part that I want to stress on. I hope I'm heard. Can you hear me, please?
Yes, sister.
Yes, sister.
Okay. The reason why I want to throw more light on this is that when the ovum or the blastocyst enters the endometrium, it burrows and entered, and then it's like the endometrium has paved way, so it enters, and then the endometrium closes over it. So the only thing that one can see of
HAJIA, please, you are now co-host, so you can mute and unmute yourself. HAJIA, please, you have been made co-host. Kindly, you can now control your microphone by muting or muting yourself. Thank you.
It's okay, go. This, I was muted. That's why I couldn't talk. Oh, I don't know what is happening now.
HAJIA has been made co-host now. HAJIA. So I think maybe she was also trying to control. Someone is controlling the microphone. I don't know. I'm not the one muting you. Please, who is controlling the microphone?
No one is controlling.
I unmute the facilitators. I unmute and then it is muted. I don't know.
No one is controlling it because
Sister
I've been able to mute myself.
Okay. Sister Betha, please unmute.
I've unmuted. So HAJIA is not in. She was talking, so I was waiting for her to finish before I will continue. But it seems she's not on it. Okay.
She has come.
Okay.
Yo, hello. Yeah, one of the
Hello, HAJIA.
So can we continue whilst we wait for her, or we still wait for her to come?
I think so. Let's continue.
We are on the early embryonic development. We have inner cell mass, that is embryoplasts. So under the so we have the early one being the inner cell mass. So during and migration due to the predetermined genetic coding, the inner mass cell forms the fetus, whilst the trophoblasts develop into the placenta. So the screen is gone. So during the early embryonic stage, or during the early embryonic development, something happens. We have the inner mass cell. So during the divisions, the cells that are found within the inner part of the development will develop into the fetus, whilst the outer one will develop into the placenta. That is what it's saying. Then the inner cell differentiates. The inner cell will differentiate into 3 layers, which forms the various structure of the organs. These three layers together are called the embryonic plates. So during the embryonic development, this is what happens. There is inner cell, then there is outer cells. The inner cell will develop into the fetus, while the outer cell will develop into the placenta. That will provide nutrients for the growing fetus. Then these layers all together are called the embryonic plates. So there is, in these 3 layers, we have the ectoderm, the endoderm, then the mesoderm. So this one will talk about only the ectoderm. The ectoderm being only the outer layer. This outer layer lies the amniotic sac, the part of the tissue that covers outermost parts of the body of the fetus.
Sister Beta, please pause and let me change the screen so that you get clearer view of what you are presenting. I want to change the background.
Okay, thank you. Yes. Okay. So I think this one is better.
Is it this one you are presenting on?
Yes.
Hello, Sister Beta.
Hello, yes.
Is it this one?
Yes, it's this one.
Okay, you can continue.
But where you are, embryonic development and fetal development, we were on the mesoderm and ectoderm. I'm not seeing it. Please, can you move a little upwards so that I can see if I'm not seeing it again. Go up a little.
Please.
What is happening?
That one is not on the one I brought. I thought it was on the same thing.
No.
Okay.
So please, we are on the ectoderm. So we are saying that the ectoderm layer that will produce some parts of the fetal body. So the ectoderm will produce the amniotic sac. Then it will also produce the tissue that covers the body, most of the body parts. Then the ectoderm tissue will develop.
Hello, sisters.
Hello.
Can we wait for HAJIA? At least she should hear what you are reading. You see, when you read something, she wanted to add something. So she was talking and she went offline. So why don't you wait for her so that at least if there's something she needs to add, she'll add up to it. And I don't know why she told. I heard her voice right now, but she went off again. I don't know who is controlling the class. So Sister Nas, if you can call her and inform her, we can't just move on like that.
She's having network problem because
So you
she's
call her.
on and off.
Call her.
Now
Let's
she's a
give the
co-host.
order whether we should continue or not. We can't just read without her presence, and if there is something she needs to add or whatever, what do we do?
Let me unmute myself and call her.
Mabel.
Sister 9, Sister Alberta, and Sister
Please,
Veronica, please
Aja
don't
is
mute
saying
yourself.
that I've called her.
Don't
She's
mute
saying that
yourself, okay?
Okay.
You say you've called her and she said what?
That's what she's saying.
I've not been able to mute. Please, whoever is controlling the
network.
Don't mute.
Hello, HAJIA. Hello, HAJIA. HAJIA network is no.
You mute me and I can't.
HAJIA. Oh, it's the network.
I want to make some contribution. I'm not able to do it. Please, can you hear?
HAJIA, your network is breaking. Come on.
Don't mute. If you're muting others, please, I'm not part of this. Don't mute me. I want contribution. I don't know whether you can hear me. Please, can you hear me? Hello.
Yes, sister. HAJIA, please, your network is breaking.
It's your network now in FM. HAJIA, it's your network. Oh, it's your network.
It's my network, eh?
Yes.
Yeah, I'm finding a place to sit to see if I can.
Hello, Sister Nas.
Yes, sister.
Please, I'm suggesting something. Next time, before you become the co-host, can you inform the tutor or the lecturer that you want to be the co-host, so that at least they will know that you are controlling the class, and they will know that you unmute and unmute them. Because look at how the number of minutes we've wasted on all this. So please, next time, before you do that, let the lecturers know that you are the one controlling the class. HAJIA had no idea you were the one controlling the microphone or whatever. So please, try and do that for us. Thank you.
So, can you now hear me? Thank you very much. Labi, thank you. Please, can you hear me? Am I heard?
Yes, sister, yes, you are.
Can you hear me now?
Yes, HAJIA.
Yes, sister. It's a network.
Okay. Now, I was talking about the implantation and the nidation, and the next thing, they are all the same. Now, I said that, okay, it's okay. If you can hear me now, let me continue the explanation. I was trying to say from the midwifery point of view.
HAJIA, please.
Your network is not helping us.
So I was saying that from midwifery. Yeah.
Please, we are not hearing you well. We can't hear you well.
Let's continue. So it's like when you see the boy
You see, right now she has left. I didn't do anything to her. Her network is taking her on and off. So I'm not the cause of that. I'm not controlling anything now. She has left the page. It's her network.
It's just a humble suggestion I'm making that next time you just inform them
Yeah, I
that
understand.
you are
I
controlling
understand
the
you, but
class. Yes.
yeah, I understand. But I'm saying that right now, no, she's facing that network problem. That is why she can't mute and unmute, and she's going on and off. I get you, Pa.
Oh, network mechanical.
Please, can we continue so that when she comes back, she can explain to us because we are
Yes.
wasting time.
Yeah, by the time she will come, we are finished.
Better, please continue.
But if it
it seems she's in again. Oh.
Yeah, she's
you
in, but
continue.
network.
So I was saying that in a situation where one wants to do you or manual removal of the no, you can now hear me. I can see you, I can hear you. So let's move on. Let's move on. Please, let's continue. Let me leave my explanation and continue.
So please, we were talking about the 3 layers, and the 3 layers being the
Just continue. You don't rush to go and make. Go ahead. Go ahead. Okay. Continue, please. The one doing the presentation. Go ahead.
Okay, please, HAJIA, I was saying that with the 3 layers together are called the embryonic plate. Then we have the 3 layers being the ectoderm, the mesoderm, and the endoderm. So we are starting with the ectoderm. So the ectoderm is the outer layer. Then that forms the most part of the fetal body, the amniotic sac. Then I can't see it well. The one sharing, please bring it a little downwards and let me see. Aha, thank you. So it also have the parts. The ectoderm also develop into the tissues, into the epidermal or the outer layer of the skin. So as we get our skin, we get it from the ectoderm. Then the hair, the nails, and the nervous system, that is the brain and the spinal cord, are being developed from the ectoderm. So as the baby develops, out of the 3 layers, this is where the baby gets its these parts of the body from. Please, can you move forward a little? Then we are going to the mesoderm. The mesoderm is the middle layer. So the mesoderm tissue developed into dermis, inner or muscle skin. So the muscles of the skin, it is found within the mesoderm. Then circulatory and uterogenital glands, the heart, the blood, and the blood vessels and the lymph cells are also found in the mesoderm. So in the inner layer, these are the parts of the body of the fetus that are developed from it. Then we have the ectoderm being the inner. So the ecto was the outer, the inner is the inner layer, the endoderm. Though from the endoderm to you have the yolk sac, then it will develop into the lining of the gastrointestinal tract, urinary tract system, respiratory tract, salivary glands, then the respiratory system, then organs such as the pancreas and the liver, they all develop from the endoderm. So 2 enclosed cavities appears in the inner mast cell, then they lie adjacent opposite to each other. Then we will move to the amniotic cavity. They lie aside the ectoderm. So amniotic cavity lies aside the ectoderm. That's where you find it. Then the cavity is filled with fluid, gradually enlarges and folds around the embryo to enclose it. So the embryo is found within the amniotic cavity. Then the amniotic cavity is filled with fluid. The amnion forms its lining. So that is where the amnion too will also form its lining. Then the yolk sac lies on side the endoderm and provide nourishment for the embryo until the trophoblast is sufficiently developed to take over. So that is about the
Awanda.
3 layers. So we are going to the trophoblast. That is in about 2 weeks, there is trophoblast, which is single layer cell. Multiples and are differentiated into 2 layers in tissues. And these are the outer syncytial trophoblast, then the inner syncytial trophoblast. So the one is the
No, the
syncytial,
inner
the one is
cytotrophoblast.
yes,
Please
sister.
take your time. Take your time. Outer syncytial trophoblast. The next layer is the cytotrophoblast. And before you come to the mesoderm, go ahead.
Okay. Yeah. Aja, please, the presentation is done between 2 groups. So we are done with our parts. So it's now the part for Asankegwa to take over.
I see. So you think what you have presented, they've been able to grab it. Ask for when you teach, you solicit for students' concern. For all you know, somebody didn't understand the points. So you ask any question. If somebody, I can see somebody's hand up. So you find out from them, do you understand? Is there any point that you want clarity? So that I can also come in and then explain it to them. But it's like, if you behave like a newscaster, the newscasters, when they read the news, they don't explain anything to anybody. They just read it and they are gone. We are not newscasters. Right?
Okay,
So
please.
you read and then explain to the understanding, especially so that if somebody didn't attend lectures today, she can ask a colleague who was present to explain it to her. That, oh, what did they learn? What did they teach you? Do you understand? Then the person
Yes,
can also
Aja.
explain it to her. Because the more you teach, the more you learn. Okay.
Okay,
So take your time. I was interested in the formation of the endoderm, the ectoderm, and then the mesoderm. Those things. I was so much interested in it, but you were in a rush anyway. Somebody's hand is up. Ask the person what
Haja, please. Haja.
Please.
Haja.
Yes.
Yeah, please, those with their
Yes,
hands
madam, go
up,
ahead.
they are the ones facilitating. Those with their hands up,
Okay,
they are the ones that have, so that I can differentiate between those that want to make noise and then those that are facilitating.
Okay, then that's fine. So any questions so far, please? In general, do you have any questions? She's done with the implantation, the fetal development, and all those things. Do you have any question? Other than that, if there's no question to ask, then let's invite the Asanko people to come and continue.
Hello, Haja.
Hello.
Yeah, please, you were explaining something about the implantation and your network took you over. I was lacking something there, but it's like your network. You can please.
Okay. Yeah, it's true. I was trying to explain that. I was trying to explain that. I've put her in the waiting room, so it's okay. Let's continue. I won't admit you until you promise me that when I admit you, you come and make noise.
Don't
we
worry,
are
I'm
finding it
muting them,
difficult
so
to follow
let's
this
admit
because
it,
of
please.
network.
I'll mute it. Please, let's admit it. We are begging.
Okay. I've admitted her.
Thank you. Hey dear, Hajia, your network is not helping us at all. Yay.
I was trying to say, fertilized ovum had burrowed into the endometrium, doesn't want the pregnancy. She wants to go and do it. She will end up not being able to catch everything herself. If it
Oh, Hajia. Hajia network, I don't know. Eh? She's back. Sister,
hello,
please.
please, can you hear me?
Yes.
Sister. Hello.
Network.
Can you hear me? Can you hear me, please?
Yes,
okay,
sister.
So all that I was trying to put across is that when it has been disturbing the woman. If in an attempt to get rid of the pregnancy, you have to wait. As soon as you miss your period, you are already 2 weeks pregnant. But if within that 2 weeks you make the pregnancy will advance. I'm talking about the them have been denying that they are not responsible for that pregnancy because I gave her money, I gave the girl money to go and do the DNC, and then later she came back to tell me that she's still pregnant. I'm not responsible for that pregnancy. She's responsible because of the wrong time that the girl went in to do the DNC. If you don't get a specialist who knows how to fill that bulge, with the curette, he wouldn't be able to curate it and get rid of the pregnancy. It will remain there. He creates something small somewhere, and then the lady sees blood after getting up from the couch, thinking DNC has been done. It hasn't been done because the fetus was hidden inside the wall of the uterus. And that alone will prevent it from being touched. And so the next moment, the pregnancy will start advancing. People have been denying their pregnancies all the time. And that is the cause. I've explained it. Is it clear? Hello? Hello? Can you hear me, please?
Hajia, the network is not clear. Hajia, check it again. Hajia, please take it again. The network, it keeps breaking. So whatever you say,
you were hearing me.
No, the network was breaking, so you were not getting it right.
I was trying to say that. Can you hear me now?
Yes, sister.
Can you hear me
Can
now?
you also mute yourself? The rest of you. Eh? You mute them and they unmute themselves.
No, so all that I was trying to say is that what I'm saying is that when there's pregnancy, you want to do evacuation of the uterus. Take your time, wait a little bit, let the breast cells come out of the uterine wall where it is hidden into the uterine cavity. And that time you can do the MVA to get rid of it. You can do that how do you call it? Meditation and purity, you can do the DNC and then get rid of it. But if it is still hidden in the wall of the uterus from the beginning, that is from the first 21 days, we are not likely to get the embryo out. It will remain in the wall. And then when we are done, we think we are done with the DNC, then it will come into the endometrium. It will come into the uterine cavity and start growing. And I'm saying that some of the teenagers might have missed this process. And so the pregnancy will continue to advance. The boy will deny the pregnancy because the baby was hidden. It didn't touch it. So in later life, we see that the pregnancy will be advancing until probably when the girl delivers, that there is some resemblance of that rejected pregnancy will prove that truly this is midwives. We need to exercise patience. Even those of us who know how to do the MVA, you have to take your time, ask for the gestational age to ensure uterine cavity before you make an attempt to do the MVA. Other than that, it becomes a failure. And you'll be accused of not doing it now, the pregnancy. I hope it's clear. Please, is that okay? Okay.
Rebecca.
I hope it's now clear. Okay. So, Asanka people, let's hear you. Asanka people, let's hear you. Please, Asanka people, let's hear you.
Rebecca,
please, let's continue. Let's continue, please. Hello? Hello?
Hello.
Hello.
HAJIA, please. I'm presenting for group 1.
Okay.
Okay. So our topic is embryonic and fetal development. Embryonic development and fetal development are a remarkable process that mark the beginning of a new life. This report explores the key stages of these processes. So please, we have the pictures over there. So please try and follow up with it. So we are starting with the embryonic development. Don't worry. The embryonic development begins at fertilization, when a sperm cell fuses with an egg cell to form a zygote. The zygote undergoes rapid cell division, resulting in a blastocyst, which then implants into the uterine wall. Over the next 8 weeks, the embryonic stage is characterized by the formation of major organ system. The neural tube develops into the brain and spinal cord, while the heart starts beating and limbs bud appear. By the end of this stage, most organs are in rudimentary forms. So please, if you look at the picture image that is there, we have the fertilized egg. Then we have the 2-cell stage. That is, so the picture there is the cell division. So the fetus births into 20 weeks.
Recording in progress.
So we get to the fetal development. Fetal development begins at the end of the embryonic stage and continues until birth.
Hello.
Hello.
Yes. Please, kindly keep your hands up and let me mute the rest. Okay, because they are still on YouTube.
Please, no, I'll take care of those who are making noise. I'll take care of that one.
Oh,
so okay. Before you mute me, I'll take care of that one. So before you mute, whoever tries to make noise, I'll put the person in the waiting room. I'll put the person in the waiting room. So you leave it and listen. Other than that, the network is not disturbing us. I mean, it's disturbing us so much. Go ahead, please. Continue.
Okay.
Please continue.
Okay, HAJIA. So please, we are the fetal development stage. So with the fetal development, it begins at the end of the embryonic stage and it continues until birth. During this time, the fetus undergoes significant growth and refinement. The second trimester is marked by the development of facial features, including eyelids, and the fetus can make movements. By the third trimester, the fetus gains significant weight and its organ system becomes fully functional. The development of the decidua. The decidua is the specialized
Please,
tissue
I
lining
hope we are not just reading the thing. Hello? Hello, lady. Please, I've told you, don't let us behave like investors. Those who read news on TV, on radio, they don't explain anything to anybody. We are not newscasters. We are medicine students doing our first degree. We need explanation to what you read. So whoever is making that noise, I'm putting her because she can't control the child. She's not controlling the child. Please allow me to put her in the waiting room. I'll put her in the waiting room. So let's continue. If you can't control your child, then go to the waiting room there and then remain there and make that noise. Please, so continue. You read and you explain nicely. Then people can follow it. If it is just...
Okay,
go ahead.
Please. Development, it begins after the embryonic stage. And we said that this stage, that is where the fetus starts to develop the eyelids. The fetus can make movements and the fetus starts gaining weight and the organs become fully functional. That is the development stage.
Okay.
So please, we move to the development of the decidua. The decidua is the specialized tissue lining the uterus during pregnancy.
Please, who are you reading? Who are you?
HAJIA, please,
please, your name so that I don't put you. Nina Roxon. Okay.
Please, the decidua is the specialized.
Okay, it's okay. Go ahead.
Lining the uterus during pregnancy. It undergoes significant changes to support the growing embryo and later the fetus. The development of the decidua occurs in several stages. So we have the menstrual phase. During the menstrual phase of the menstrual cycle, the old decidua from the previous cycle is shed along with the unfertilized egg if pregnancy has not occurred. So please, we learned that in the menstrual cycle when we were teaching it. So then we come to the proliferative stage. So after menstruation, the endometrium starts to thicken and regenerate under the influence of estrogen. The endometrial glands elongate and become more tortuous. Then with the secretory phase, following ovulation, during the phase of the menstrual cycle, the endometrium continues to prepare for pregnancy. If fertilization occurs, the embryo begins to produce human chorionic gonadotropin, signaling the corpus luteum to secrete progesterone. Progesterone prepares the endometrium for implantation by causing the glands to become more tortuous and filled with glycogen and lipids. This phase is essential for the establishment and maintenance of pregnancy. So please, with the development of the decidua, we say that during the menstrual phase, when there is no pregnancy, the decidua, the unfertilized egg, there is shedding of the decidua. And with the secretory phase, when ovulation occurs, the uterus prepares itself for fertilization. It prepares itself so that when a sperm enters, fertilization can occur. by producing human chorionic gonadotrophin. So decidualization. After implantation, the endometrial stroma cells undergo a process called decidualization. Decidual cells are large, pale, and rich in glycogen and lipids. Decidualization is crucial for the formation of the maternal-fetal interface, providing essential support for the developing embryo. Decidual cells surround the embryo, forming the decidua basalis, which anchors the placenta to the uterine wall.
Hello, please let me come in here. The last point that she just shared. Hello, can you hear me?
Yes, sister.
Can you hear me?
Yes, sister.
Okay, talking about the decidua basalis, where the placenta is anchored. Please, what actually happens is that there is a layer above this decidua basalis, and that is called a layer of nitabush. It is on top of this layer. That is the limit of the trophoblast, the limit of the placenta attachment. If it should go beyond this layer of nitabush, placenta acquita will be the outcome. If it should penetrate through the layer of nitabush to get into the myometrium, that is where placenta, either retained placenta, which is an acquita type, will ensue. I hope you get it. So sometimes you are doing manual removal of the placenta, you try to separate the placenta. Separating is because of the layer of nitabush to enter the myometrium, and that is causing the retained placenta. I hope it's clear. Please move on. Go ahead.
So please, we move to formation of decidua capsularis and parietalis. The decidua capsularis covers the embryo and amniotic sac, forming a protective layer. The decidua parietalis lines the rest of the uterine cavity, enclosing the gestational sac and amniotic fluid.
Yeah.
Please, is it well understood?
Hey,
are saying that
you have to find out from them. Find out from them whether they do understand what you are saying.
Please, do you understand the capsularis and the parietalis?
Go over it for them.
We are saying that the capsularis, it covers the embryo and the amniotic sac, forming a protective layer. Yes. And the parietalis, it lines the rest of the uterine cavity, enclosing the gestational sac and the amniotic fluid.
Good.
So throughout pregnancy, the decidua continues to play a vital role by secreting hormones, nutrients, and growth factors necessary for the development of the fetus. After childbirth, the decidua sheds during the process known as postpartum or puerperal period, marking the end of the pregnancy-related changes in the uterine line. So that is what we normally see as the lochia. Yes. So the lochia that we see during the postpartum period, it is actually the shedding of the decidua. That shows that the pregnancy has come to an end. So we come to the important stages. The important stage in embryonic and fetal development involves the following. 1. Formation of organs. During embryonic please minimize the screen a bit. Okay. During embryonic development, the heart, brain, and major organs form. Then development of limbs. Limb buds appear and gradually develop into arms and legs. So we know that the fetal development, we said it started right after the embryonic stage. An embryonic stage is where there is cell division, the division of the zygote. So during the fetal development, that is where the organs of the fetus starts to form. So the heart develops, and the brain, then the major organs in the system, they start to develop. Then their limbs, you see that their arms and the legs will also start to develop. So please, we've already, I don't know if the picture is clear. So if we look at the last picture, we see the limbs and the arms and the legs already developed there. So we come to the fetal movement. Fetal movement become pronounced during the second trimester. So during the second trimester, the fetus becomes active and it becomes very viable. So it starts to move in utero. Then viability, around 24 weeks.
One thing is that, hello. Is the fetal movement. Try to distinguish. Can you hear me?
Yes, HAJIA.
Distinguish between the primigravidus and the multiparous one. Yeah, make the distinction so that a primigravida wouldn't feel this fetal movement that we're talking about during the early pregnancy. A primigravida wouldn't feel it like a multiparous woman. She had become pregnant before, she has delivered before, and so she experiences the fetal movement in the early stage because she knows how the fetus kicks in utero. But the primigravida hadn't become pregnant before, so sometimes it takes about 20 weeks before, 20 weeks to 24 weeks before the primigravida will experience the fetal movement. While that of the multiparous woman will experience it around 20 weeks. Around 20 weeks or 18 weeks, the multiparous woman is experiencing this kind of movement because she's experienced and she knows how what it takes for the fetus to move in utero. I hope it's clear. Please, do you understand?
Yes.
Hello.
Hi.
Is it clear now? Okay.
Yes, sister.
So let's continue. Please, the one who shall be making noise.
Please, sorry to take you back. You were saying something about MVA and the gestational age. Can you please clarify the gestational age we can get a successful MVA done? Because your network was breaking.
I said within the 21 days after fertilization, ideally 21 days after fertilization. That is where days after fertilization. So prior to these 21 days, remember the zygote is inside, it has burrowed inside the uterine wall. And so after 21 days, that it will come into the cavity of the uterus, find a suitable place, and then it will start hovering inside the uterus. So that time, if you want to do any MVA, you are likely to grasp or get the fetus. Other than that, sometimes you do it and it doesn't even hit the fetus at all. It's inside the uterine wall. So that is it. Or if you have experienced a situation where you did the MVA and the patient comes back to tell you that, Madam, the following month, the next 3 months, I haven't menstruated. It means the thing wasn't done well. It wasn't done well. So what you can do is to leave the pregnancy, leave her to deliver. Maybe you support her financially because you didn't wait to do it well. Please, let's continue.
Okay, HAJIA.
Okay.
So please, we go to the viability, fetal viability. And mostly it's around the 24th week of gestation.
Hello.
Hello.
Sister Vivian, please unmute yourself and ask your question.
Mr. Nas, please, why can't you finish so that they can ask their questions?
Oh, she has raised her hand.
Fine.
Please, sister. Someone, let me join. How many come by? Me, yes, and
Abigail Togo, I'm putting you in the waiting room. Abigail, you do in the waiting room with your noise. Go there and make the noise. Please go ahead.
Sister, please, I need clarification on the gestational age. You said from the 21 weeks
Gestational
that what you are explaining about the DNC. Sister, there is this new method, the Combi Pact. Primary stove.
Okay.
We were told the limit for a midwife is from the first week to 12 weeks.
Okay.
And above that week, we are not supposed to try. So with the Combi Pack, I want to know, as after that time, as at the 12 weeks, the embryo is still not out of it's still not in the uterine wall. So, but when we use the Combi Pack, it works. So I don't know if you are getting what I'm trying to say. I don't know how you can clarify that for us.
HAJIA, please, you have said yourself.
How do you go about it? Hello? Hello? Please go ahead with the question. You said, how do I clarify that one for you? And I'm asking you, how does it look like? Because I haven't used the Combi Pack before. How does it look like?
It's a combination of mifepristol. It's combination of mifepristol and then misoprostol. So there are 5.
Okay. So how do you do it?
There are 5. The client will take the first one, that stands alone, will swallow it. Then 24 hours, the same time the following day. You will insert 2 each into each jaw. And be swallowing it as it dissolves, you be swallowing it. The mouth. 2 each will be inserted in each jaw. You insert 2 here, one jaw, insert another 2 at the other jaw. So as it dissolves, you'll be swallowing it small.
Okay.
That is how the procedure is done.
Okay. It will work from the first week. I agree with them. It will work because this is hormonal something and it is working directly into the bloodstream. You swallow it, it will be absorbed into your bloodstream and cause uterine contraction.
Because look at the transport. At the end of the month,
HAJIA, please unmute yourself.
Thank you. I'm saying that it will definitely work. The use of this misoprostol thing, it will definitely work because it has something to do with contact with the blood directly. It's like he swallows it, absorption will take place. It's a hormone, it goes straight to the uterus, and that's causing uterine contraction, and it will definitely work. We are talking about dilatation of the cervix and curating the uterus. And we are saying that because the blastocysts had already burrowed into the uterine wall, if it hasn't come into the uterus, and you don't let a professional who can identify where the bulge is in utero, because you can't see, and then curate that part, cause erosion, and then get rid of the fetus, the pregnancy will still progress. If it is not properly done, the pregnancy will still progress. And sometimes the man will try to be to say that he is not responsible for that pregnancy because he knows they have done UOU or DNC. And we are saying that if you want to go by entering the uterus, then wait till the blastocysts get into the uterine cavity. But in the course of this drug that they are talking about, in a week's time, 10 days time, you can still get the uterus contracted and expel the product out. So there are two different issues that we are talking about here. Please,
Okay,
do you
sister,
understand?
yes, sister. Stephen wanted to ask a question, but
okay, so continue.
Sister,
come again, say what?
Stephen wanted to ask a question, but you kept him in the waiting room.
Because she was making noise, that's why.
No, his background was noisy, but he wanted to ask a question. Okay, James, go ahead.
I omitted her. Please, I brought her back. I've brought her back, okay, so she can ask a question. I brought her back. Go on. Question.
Good morning.
Okay. Go ahead, please.
Good morning. Please, concerning the retained placenta, you were talking about it, but you didn't get that one. You were saying something about retained placenta. Why sometimes the placenta gets retained?
I said he was talking about the layers. The basalis. He was talking about the basalis on top of which we have the placenta embedded. And I said there's still a layer called the layer of nita bush on top of the basalis. And that is the basal layer. And I'm saying that it is the layer of nita bush that prevents the morbid penetration of the trophoblast into the myometrium. If the layer of nita bush is not there, the placenta would have been embedded into the myometrium. And I'm saying that will still penetrate, pass through it, and enter the myometrium, bringing about placenta accreta. Placenta accreta. And sometimes it can even pass through the perimetrum and then get what you call placenta pacreta. It will end up with placenta pacreta, where at the end of the delivery, unless they do hysterectomy to remove the uterus and the placenta that is penetrating all layers, the placenta will never come out. But then they will consider the parity of the woman. How many kids has he gotten? So that they don't do the hysterectomy if she's having only one child. If that is the first child and she's having placenta accreta or pacreta, then what they will do is they will leave the placenta in situ. They wouldn't do the hysterectomy. They will leave it in situ, put the woman on heavy antibiotics so that placenta will dissolve by lymphatics, but it will take some time. That is all that I'm seeing. I think recently one of you had a similar issue like that. One of you had a similar issue, and then got so good, she's now fine, and she has joined you. We're thinking that it is the patients, the clients who can get such a complication. You see, it happened to us too. She had it, we all prayed for her and got so good. She had her baby, and then the placenta problem. We'll end it here. So that is it. That is all that I was trying to. Yes, would you like to eat with me? Yes. Go there, and the noise is coming here, and they will do. Hello, I hope you get me.
Yeah.
Okay, that's good. So please, let's continue.
Please, HAJIA, is the placenta pacreta the same as placenta increta?
Yes.
Okay.
Okay.
It's the same thing. We have the accretor. Some of the accretor, manual remover can bring it out. But once it is accretor, penetrating all the layers into the perimetrum, that one, hysterectomy will have to be done, depending on the parity of the woman. That's what I'm saying. Okay. Please go ahead. The one doing the presentation, go ahead. Please, when it's time for labor, draw my attention so that we can shift to labor.
Okay. So, HAJIA, please, we have the fetal viability. We know that fetal viability is the ability of fetus to survive outside the womb. And normally, this starts around the 24 weeks. And we know that at this stage, there will be development of the lungs, the brain will start to develop, there will be the organs will start to mature. Yes. So that is the fetal viability. And we come to the final growth. So in the third trimester, the fetus gains weight and stores nutrients. So when we started from the embryonic phase, there will be fertilization. Then the fertilization, it will go through the process, the cell division. Then it will start to develop. Then after they start to develop, you see that the organs of the fetus will start developing. The lungs will develop.
Somebody's hand is up. I don't know who the person is. I don't know if it's an old one. Whoever is having her hand raised.
James, Sister James, unmute yourself. Sister James, unmute yourself and ask your question. Sister James.
Oh, I'm done asking it. I have to put my hands down. Sorry.
So please, after the cell division, then the fetus starts to grow. The organs will start to mature. The limbs come. Then we come to the final growth. So after all this process, then we come to the birth. When the fetus is now fully...
Put your hand down so that we can continue. Please go ahead with the presentation.
So when the fetus is fully grown, the organs are fully matured. It has gained the norm appropriate weight. Then we come to the birth. So the fetal development culminates in childbirth, with the baby being fully developed and ready to survive outside the mother's womb. So in conclusion, we are saying the embryonic and fetal development are a complex process involving the transformation of a single cell into a fully formed human being for 9 months. These processes are a testament to the and beauty of life. Understanding these stages is crucial for prenatal care and ensuring the health and well-being of both the mother and the developing fetus. Thank you. So in the embryonic to the fetal stage, it starts with the cell division, cell fertilization, the cell division, then it goes on to the maturity of the organs, then to final growth and birth. So that is it with our topic for today. Thank you.
You're welcome.
Yeah, well done. You have done a very good work. Please, I get your presentation. I want you to say it for everybody to hear. How do I get the presentation to score you? Will you put it in my mail? Or you want to combine and bring it to it? Please, I'm asking the group.
Sister, please, the first one that the Akimoda people presented is combined with ours, but because the background was down, that's why we decided to bring a new background in. So the one they presented to you combined both of...
But you can still...
HAJIA, so we will combine.
We've
combine
combined
the
the two, but because the background was very down and people couldn't read, that is why we decided to change this one. So the one that was sent to you is combined.
Have they sent it already?
No, please.
They've not sent it.
So if you send it together, the two groups, you send it together. And send it together so that, and I'm asking you, are you going to combine and send it, or you put it in my email? That's what I'm saying. Which is the yes, sister?
Sister,
which one is the yes?
In your email.
But you have my email address. You have it. You have my email. Do you have it? Do you have my email?
Please, can you give it to us again?
Do you have my email address?
No, HAJIA.
Yes.
If you don't have it, so how are you going to use it? You have it. Fine.
I'll send it.
Okay, let me give it to you again. Let me give it to you again. Okay, just write it down.
Okay, sister.
So I'm giving you the email address, okay?
Okay, sister.
Please, that is my email address. That is my personal one, so you can put it in this one, okay? Or better still, you can use that of the school's address. Let me give you that of the school's email address, okay? So that one is like, it's like this. That one is this is the school's own, so you can still put it in this email. Hello, please, can you hear me?
But please, we can't see the email address.
Huh? Okay, let's continue. Nina Roxon. I can see your hand up, Nina.
Please, I was presenting. I was the one presenting.
Okay. So I better I think we are done with the anatomy and physiology of the reproductive system. Please, can we shift to the labor? I'll tell Dr. Odepoku.
Sister, please, she said that you can take it. You can take the first 4 hours. You'll meet us at 4.
Come again.
Please, doctor says
Come
you
again.
can take the first.
You said what?
Please, doctor says you can take the first 4 hours.
Yes. Oh, okay. That's fine. Hey.
The network is not helping us. HAJIA.
We have to break for people to go and eat and come. Oh.
Yeah, the network is not even helping now.
Continue
It's
with
not making
the
sense.
labor.
The class is active. Adia. Hello, sister. Hi. Maybe I'm social crying.
Let us, please, are we to go back and come again? Are we on break? Hello? Can anybody hear me?
Yeah, me.
Please, are we on?
Hey, eat your food. Mm.
Or we should join the labor, we should use the labor link.
No, we are going for 15 minutes break. We are tired. We need to stretch.
So we should use the labor link, right?
She didn't say anything. She was.
Yes, you use the labor link. Put that in.
But all joking aside, sisters, the rate at which you unmute yourself is too much. I have to stop whatever they are teaching to come and be muting and muting and muting. Sometimes HAJIA will keep you at the waiting room. I will go and admit you. The moment you are admitted, then you come and unmute yourself. Sister, should I leave the noise control so that all of us will not benefit? You go and mute the person, then in the next seconds, you see that the person has come to unmute herself. Oh, let's try and mute our microphone, please. When you are not the one facilitating, mute yourself. If you want to ask a question, just raise your hand. Then the opportunity will be given to you, please. You unmute, they will mute. You mute, they will mute. I don't know why. Why do you do that? So, I am concentrating, and you're fine. Yes, I will stop. So all of us, you know.
Look, Anna, please, are you using the labor link or we are going to use this?
I don't know. She didn't say anything, so I don't know.
Please find out.
Using the labor link. I believe so. So let's go for the break and then come back.
Sisters, please, at what time are we coming?
Please, it's 9:15, I think.
It's 9:15. I suggest we should come back at 9:30.
Okay. Thank you.